Observe the discrepancy in these two rest cycles. The top axis shows the standard 8 to 9 hours of sleep, resulting in a clear peak of wakefulness. But look at the bottom axis. This tracks a 14-hour cycle where the energy metric remains stagnant, failing to rise even after the person wakes up. This is hypersomnia. It is a physical trap of daytime fatigue that leaves an individual in a state of heavy, inescapable exhaustion that persists regardless of how long they stay in bed. In a workplace setting, the impact is immediate. A person can be mid-task when their body begins to shut down, forcing their eyes closed, making it physically impossible to maintain focus. When 14 hours of sleep fails to produce alertness, it indicates that the relationship between sleep duration and recovery has broken down. This suggests that the body's internal mechanisms for restoring energy are no longer responding to standard rest. The condition reaches beyond simple tiredness, affecting cognitive performance. Patients find their memory weakening, struggle to find the right words, or express thoughts clearly during conversation. This mental strain is often accompanied by physical and emotional changes. It's common for those affected to deal with constant stress, a sudden lack of interest in food, and a persistent sense of irritability. These symptoms form a cycle. As the diagram shows, cognitive decline increases physical fatigue, which then intensifies emotional stress. Each node feeds the other, creating a downward trend that becomes increasingly difficult for the patient to manage. The interaction of these symptoms shows how hypersomnia impacts the body's broader systems. To find a solution, we have to look at the specific internal triggers causing this sustained state of exhaustion. Hypersomnia functions as an umbrella symptom. It arises from several distinct internal triggers that disrupt the body's natural rhythms. One primary cause is structural neurological trauma. A physical head injury can damage the neural pathways that the brain uses to signal the body to wake up. This is visible in the brain's regulation centers. In conditions like Parkinson's disease, these specific areas lose their ability to send clear signals, leaving the brain unable to effectively transition out of a sleep state. There is also a significant genetic component. When we overlay a genetic tree onto these neural centers, the data suggests that a family history of these symptoms increases the likelihood of an individual developing the condition. For these patients, the brain's physical hardware has changed. Their own biology is overriding their will, keeping the body in a state of unwanted sleep. Other triggers are chemical. Clinical depression can disrupt the nervous system, leading to a state of profound lethargy that mimics the physical exhaustion of a sleep disorder. Certain medications used to treat separate health issues can also play a role. These can act as suppressants that induce high levels of daytime sleepiness as a secondary effect. Lifestyle factors like obesity also contribute to the condition. The color gradients on this silhouette show how high BMI profiles correspond with energy depletion as the body struggles under the metabolic strain of regulating energy. Substances like drugs and alcohol further complicate the issue. They can interfere with the sleep cycle and suppress the nervous system, leading to a lingering state of sedation. One of the most common triggers is a lack of sufficient sleep at night. When the body doesn't get restorative rest during the proper hours, it attempts to compensate with debilitating sleepiness during the day. Whether the cause is a physical injury, chemical interference, or a disrupted routine, the result is a sleep-wake cycle that is no longer functional. For those whose hypersomnia stems from neurological damage, finding a permanent cure can be a significant medical challenge. However, when the condition is linked to lifestyle or chemical factors, there are clear steps a person can take to regain control. Reducing the use of substances like alcohol is a priority. Removing these depressants allows the nervous system to begin functioning without outside interference. Environment also plays a crucial role. This room is designed for alertness, using natural light and rigid seating. Staying in active, bright environments during the day helps the brain resist the urge to drift back into sleep. Diet can also be adjusted. Avoiding large amounts of sleep-inducing foods, such as curd, helps prevent the post-meal lethargy that often triggers a hypersomnic episode. Managing the condition requires an intentional effort to change daily habits. By redesigning their environment and routine, patients can push back against the body's urge to shut down. We have seen how the paradox of excessive sleep and constant exhaustion is often rooted in neurological disruptions and chemical imbalances. The impact on memory, mood, and daily cognitive function makes this a difficult condition to live with. The biological and chemical evidence identifies this as a documented physiological reality. Identifying hypersomnia as a biological issue is the first step toward recovery. By seeking medical advice and adjusting their lifestyle, those affected can begin to reclaim their waking hours.